So we ran a case study. We wanted to see if we could improve follow-up scheduling rates without a human care navigator, as well as improving case closure rates without a human care navigator. So I'll tell you a little bit about that study right now. We did three main things. We automated the identification process of these patients, so using natural language processing to determine if follow-up imaging was recommended as per the ACR guidelines around follow-up imaging. In addition, we automated the reminders out to patients. So we identified unscheduled patients, sent messages encouraging them to speak to their referring physicians. We're not bombarding them with messages saying, you have an urgent finding, you need to come back, we need to schedule your appointment. It's really about encouraging the interaction with the healthcare system and making that conversation happen. That's the most effective way that we've seen to get patients to take an action. And then on top of that, having the ability to do automated conversations. If we see that patients have not been adherent with their referring physicians and coming back to schedule those exams, we want to find out why. So we send patients automated messages after 60 days beyond their recommendation dates, and we engage them in bidirectional conversation to determine what the reason was that they didn't come back. Could they not afford it? Did their doctor not think it was clinically necessary? Did they go elsewhere for that exam? And taking in this information gave a lot of insights back to the health system that we were working with. So the results of this were pretty impressive. We were able to schedule 24% of open cases without any human intervention. So just simply reminding patients and identifying them at the right time had a 24% improvement rate on the open cases without a human. In addition to that, we were able to close the loop on 50% of open cases. So this is including scheduling patients for their outstanding exams, but for the patients that did not schedule, finding out the reason why. And there were a number of reasons: scheduled but didn't complete the exam yet, so getting visibility on that. Their physician didn't think it was clinically necessary, they went someplace else. Cost may have been an issue, or they just didn't want to be bothered by the health system. And it's not what you want to hear, but it's data and it's feedback and understanding why that patient did not come back.